If I told you there was a simple blood or saliva test you could do that would save your life and that of your relatives, would you do it? I hope you would. 1 in 40 Ashkenazi Jews carries a mutation in either BRCA1 or BRCA2. These are two genes in which mutations greatly increase the risk for breast or ovarian cancer. Each year in Israel, we see hundreds of women who had breast or ovarian cancer that could have been prevented if they knew they were carriers of this mutation before they became affected. This is obviously not just an Israeli issue. Ashkenazi Jews worldwide, of whom there are millions, are at the same risk, 1 in 40, of having the same mutations. Ideally, we would like to test every Ashkenazi Jewish woman for these mutations. Why? Because if she is the 1 in 40 who does have a mutation in this gene, there are things she can do for early detection and for prevention of cancer that will significantly reduce the risk that she will ever get the cancer and will also substantially prolong her life. What if a woman is already affected with breast and ovarian cancer? It's not too late to be tested genetically, and it's still very important. We know that if a woman became affected because she has a mutation, this influences the choice of surgery she will undergo, it will influence the choice of chemotherapy if she needs it, and today there are also new, novel, targeted therapies that are especially effective in women who have mutations. There are implications not only for the woman herself, but also for her relatives. If a woman became affected because she has a genetic inherited mutation, this could mean that her mother, her sister, her daughter, her aunts may also be at risk for inheriting this mutation and also being at very high risk for cancer, which they can prevent if they know that they are at high risk. What about men? Men are not off the hook either. Men can also be carriers of these mutations, and this has implications both for them and for their daughters. If we talk about the men themselves, we know that carriers of mutations in BRCA1 and BRCA2 are also at risk for prostate cancer, for breast cancer, even though they are male. They can have higher risk for pancreatic cancer, melanoma, and other malignancies. Importantly, men can pass on the mutations to their daughters, and if they are carriers, that might also mean that their sister or their mother might also be at risk. People tend to think that family history of the so-called feminine cancers like breast cancer and ovarian cancer are important only if they come from your mother's side of the family, but that's not true. It's just as important if that history exists in your father's family, because he could be a carrier and could pass on the mutation to you. When do we suspect that there is a genetic mutation or genetic predisposition for cancer in the family? Obviously, if there are many cases of cancer in the family, particularly in multiple generations, if we see cancer at a young age, that is below age 50, if we see one person in the family who has more than one cancer, for example, breast cancer and ovarian cancer in the same women, or if there are unusual cancers like breast cancer in a man. However, research we have performed shows that in about 50% of cases in Ashkenazi Jews, even though a person has a mutation, that person does not have a family history, even though they could be at very high risk for breast or ovarian cancer. How does that happen? Well, many families are small. Sometimes information is lacking about previous generations, especially in families that have undergone the Holocaust. So there might be people in the family that have had cancer or could have been carriers, but they never reached an age where they would actually develop cancer. The bottom line is that 50% of people who are at very high risk will not know this if they depend only on their family history. That's why we think every Ashkenazi Jewish person should be tested for BRCA1 and BRCA2 mutations. To spread the word about BRCA1 and BRCA2 testing in Ashkenazi Jews, the Israel Cancer Association has launched the Prevention Generation program. This program is meant to facilitate and ease access to genetic testing. If you're interested in having the genetic test, what can you do? In Israel, you should go into the Israel Cancer Association website and look for the Family History Questionnaire, which includes an automatic referral letter to your family physician. In the United States and in other countries, you should speak to your care provider about getting genetic counseling and genetic testing. I should also mention that there are also options on the internet for direct-to-consumer testing. Although we advocate having testing after genetic counseling, these options are also available. The whole idea of finding out that you are a carrier is because you can now prevent the cancer from occurring. There are many choices and options of doing this, and these are detailed in our English brochure, which you can find on the Israel Cancer Association website. You should also consult your care provider and the genetic counselor about your options if you are found to be a carrier. The reason we call the program Prevention Generation is because you will be preventing cancer not only for yourself, but also for future generations and previous generations and existing generations. These are your relatives. If you are found to be a carrier, it's very important to inform them of this so they can have the same chance to see whether or not they carry the familial mutation and prevent cancer in themselves if necessary. There's a gene in generation, use it for prevention.